That's a good question. I get a lot of calls about infections, and what patients have to understand is that anytime you open the skin is our biggest preventer of infection. So anytime you have a surgery or anything like that, there is a risk of infection. The challenges for a medical malpractice claim is whether those doctors and nurses recognize that infection and then went ahead and treated your infection appropriately. If they did those things and unfortunately you had to have additional surgeries or what we call debridement is where they go in and clean out the wound and things like that. That's not necessarily malpractice. Those are just what happened as a result of this infection. That was nobody's fault. It just sort of happened. So the extra costs and hospital stays or visits or things like that you have to have, that gets covered by your health insurance because it's just something that happened. That's not medical negligence or medical malpractice. One of the challenges is that with deductibles being so high, patients end up being out more money, and that's where they get frustrated because they're like, I wouldn't have had to pay this had I not gotten an infection. But unfortunately, it's just a bad result is what we call that versus a bad medicine or medical malpractice. So it does get covered by their insurance. Again, it's the timing of when the infection happened. When did they recognize it? Did they take the appropriate protocol to stop the infection? Sometimes you have infections that are fast moving, and no matter what treatments or plans the doctors put in place, it's just going to go on its own, and that's nobody's fault. So it depends on the timing of it and what care you received and whether an infection type case can move forward.